Yes, sir.
Anything that you can.
Nothing, sir. No queries. I don't have.
Yes. So, and Dr. Aishwarya, Dr. Hitanshi,
Sir, anything we need to read before comments?
see, what you do in your practice, we just want to know. Right? Books have written many things. Okay, versicolor, what is the management? Pityriasis rosea, you know what is the management. I think what you basically need to do, we want to know what you really do in your practice. Like when a patient come to you, uh, there are n number of options to treat. So how you decide which drug to give? What dose you think? When to call back the patient? What changes you can expect at what time? So these are something that you cannot read it in any books. Rather, you need to see the patient, understand what is the body weight, what body weight, how much we should give, when should we taper the steroid, and how should we taper the steroid. All these things are very practical things. So we will be teaching you these tips, like how to taper the steroid, how to start
Yes,
methotrexate, when to give cyclosporine, like tofacitinib. This is a very common molecule. How to start tofacitinib, how to give, how to apply topical steroid, what, how to combine all those modalities. Because I think what I have seen in our practice, you will see that we combine a lot of things. We don't believe in giving monotherapy. Like steroid, we cannot continue giving to the patient. So we try to combine like a steroid sparing with
yes,
steroid, like how we combine, how we taper off steroid, long-acting drug, short-acting drug, how we combine, how to do the transitional phase, how to maintain the patient on long-term remission, so that patient don't get relapses very frequently regarding the chronic dermatosis. So everything like we will be discussing, like, and many patients in our setup are going into remission for longer time. See, eczema and psoriasis are not curable, but our job is to maintain the patient on long-term remission. So how to maintain that long-term remission? Like what
yes,
are
sir.
the tricks? How to do the tricks so that patient goes on to a long-term remission? So that is the basic thing that we are going to discuss in this workshop.
Oh,
And
Sir, just one query, sir. Hello, sir. Is it audible?
yeah, you are
Hello?
audible, Dr. Harish. Yes.
Sir, for example, regarding the management of various dermatological conditions, we have wide range of treatment options. So, like for patients who are really affordable, we can think about start giving any biologicals or so and so. So, will there be any kind of emphasis be given in this particular workshop, like when to start on biologicals for the people who are actually needed? Those like will biologicals be given a little bit of importance? So, I just want to ask, sir.
Yeah, see, to be very honest with you, I belong to a place which is a tier 2 city, and here the patients are not
Okay, sir.
affordable. So, though we want to
Okay, sir.
start biological, but because of the cost of the uh, biologicals, we are not very much into biologicals as of now. But
Okay,
here,
sir.
what we are doing is we are promoting methotrexate as a poor man biological. So how
Yes, sir,
to
I understand.
start methotrexate as a poor man biological, that you will definitely learn. Like how to manage
Yes,
patient
sir.
in resource poor settings. See, anyone
Okay,
can
sir.
treat atopic dermatitis by dupilumab. So you just inject and it's
Yes, sir.
gone. So that will give a magic.
Yes, sir.
But it is the credit
Yes, sir.
will be if you treat with methotrexate. There is the real credit,
I
and
understand. There,
patient goes into a long-term remission with very cheap medicine. So
okay, sir.
I think that is really that we will be discussing in this workshop. So
Sir, yes, sir. I understand, sir. Sir, another one query, sir. Like for example, like in a real life scenario, how to promote ourselves in a very public scenario, will that also be covered in our
yeah,
workshop,
of
sir?
course, yeah, of course.
Like
Like
how to promote
uh,
ourselves?
yeah, I will just after this brief, I will give you one presentation now only. So I will tell you about how I started
Yes, sir. Yes,
my
sir. Yes, sir.
journey, and then how I
Yes,
went
sir.
up to around 10 years journey, and I'm doing whatever I'm doing now, how I have done it. So hopefully that will be of help to you also.
Yeah, yes, sir. Thank you so much, sir. Yes, sir. Thank you, sir.
And I have also started recording this because some of the participants like Dr. Subrat, Dr. Sargam are unable to join because they're busy in their OPD. So hopefully in this uh, presentation, because now I'm going to do a presentation, which will be basically on the on my journey on private practice. So is it visible?
Yeah, yes, sir. So it's visible, sir.
Okay, fine. So I think the participants who are there, like Dr. Kavi and Dr. Dharmendra, they must have seen this presentation earlier. So it will be quite a familiar thing for them. But to the new participant, thank you very much. And this particular slide is very close to me because it is written in different languages. I don't know whatever the other participants might be having familiarity with this languages and all, but so thank you very much at the outset to be a part of this workshop. So, so this is about me. Like I'm a consultant dermatologist in my clinic Arogyam, and I'm nowhere else attached to any other place of work. So I have been contributing to IADVL too as administrative post, and I have quite a few number of academic achievements in my tenure. And my area of work interest, of course, derma practice, aesthetics, pigmentary disorders, vitiligo, melasma, trichology, dermatosurgery. So coming to the roadmap of this workshop, like we have arranged one webinar now. I was expecting to make it around 2 to 3 webinars, but somehow I couldn't manage time. So we'll have one webinar now, and we'll go on to the Derma Practice Workshop on the 18th of this month. So, like, Rome was not built in a day, and any person who is starting to pursue a Derma practice should understand that it is brick by brick that we build on our Dharma practice. So this is my staff, my clinic people who have helped me over the years to build my practice. Whatever I am, it is because I have been helped and cooperated by all these people. Of course, my wife who always stood beside me and supported me in my difficult time. So thank you to all of my staff. So this was how I was when I started all alone, going into a misty area, not knowing what I have in store. So this is something which was very intriguing. It was with a lot of enigma. I didn't never knew where I am going to, and also I was having a lot of questions. Like I never knew what I was doing right or wrong, whether I'm joining only sole private practice, so it is the right thing to do or not. I was not very sure. But gradually, I understood that embracing the struggle, like if we embrace the struggle, it is our greatest teacher. And many struggle in my life has taught me the biggest lesson. So I hope I will share them with you. And so initially, we need to understand that we will not get patients because most of the uh, practitioners who are very young, who are uh, uh, very young and are not having much of an experience. So they do not get patient. Patient will not come to them. But they need to understand before we grow up, it is very important that we grow down. It is about being grounded and understand the rules of the game, like how we are going to practice. The initial years, like initial 5 years, I would say, will teach us how to be grounded and learn the basics of the private practice because the foundation of a house also is made on the foundation, which is not seen and is below the ground. So you have to learn some basic things before we enter into Dharma practice. So Dharma practice is a daring adventure, I would say. Like every day will bring up something that will give you an opportunity to learn if you are very daring, like Helen Keller was a blind lady, but she could manage a lot of things in her life. So we are like that. When we start, we have nothing in hand, and we can make it a daring adventure if we are really that daring. So my initial years were something like this. So what I thought initially to have a private practice, uh, the confidence that my teachers gave me was, if I treat well, patients will definitely come. And if I don't treat well, then patients will not come, and I will have to learn more and more how the art of treating the patients better. So it is always important to treat well. Treat is not about the medicine. It's also about your behavior, your demeanor, your acumen, everything together. So if you have to treat your patients very well, and patients will gradually build up. It's not in early days, but someday patient will come. So you have to have patience and not lose patience at any point of time in your life. If the patient do not come, I will try to upgrade my skills. Initial days, I had very few number of patients, below one, below five, sometimes zero. But I tried to upgrade my skills by reading different books, by being in IJD group of Facebook, understanding many work, sharing my work, and also keeping on thinking on how I can upgrade my skills. So initially, financial requirement was quite an issue. So I had some peripheral outstation visits where I arranged some funds, and that helped me stick to my dedication to my prime location. And that days of sticking to prime location is very, very important, because that is your final location. So initially you go on to the peripheral visit, so gradually taper off, and you finally stick to your own location. So this is somewhat my journey in very short. So this is how my mindset gradually built up. So so initially, I was a completely person who was lost. I was not found anywhere. My friends, my teachers, everyone never saw me. I was not into any conferences. I was just trying to build my practice. So it was a gradual metamorphosis, you can say, which allowed slow and gradual changes in my practice. I used to learn small, small things, how to counsel patient, how to spend time, what the patient want to listen, how can I be more appropriate in my approach to psoriasis, eczema, the common diseases. So gradually, I started learning the nuances of private practice. So many days was zero patient days. Was really scared about these days when I didn't have patient. Initially, I was scared, but later I took it as an opportunity to upgrade, because the upgradation was like this, like academically, organizing my work, place and work, staff training, like I had to train my receptionist, I had to train my procedural technician about how to work properly, how to do things nicely. So all this gradually became easy for me, because later when I got busy, those people were my real resources and assets, which helped multiply my time, because we have 8 hours. So together, all the staff will have 24 hours. So three staff together will give you 24-hour extra. So if you guide them well, if you build them well, are going to help you out. So I trained my staff. Also, I prepared many counseling YouTube videos in that time, because I had a lot of time in my disposal during those time. I tried to make many YouTube videos regarding eczema, psoriasis, skincare, and also many flyers and disseminated. Those days were not like now. Like, we had very limited resources. Only
Hello,
Facebook and were there. So
go.
we tried to meet some flyers also at the time, and also Facebook Live awareness programs in different days, like Psoriasis Day, Health Day,
हाँ
all that.
हाँ
So awareness also tried to spread. TV shows we attended, and those TV
हाँ
shows we have also
हाँ
uh,
हाँ,
uh,
तापरे
we recorded in our YouTube channel, so that we also disseminated to all our patients who come up. Like psoriasis
फोटो
patient
में
came, we send them the link of the YouTube
फोटो में देखते
video, so that
हैं
anytime they are free, they can watch the TV shows for themselves and understand the disease better. Also about advertising and visibility, also worked on that, and analyzing the psyche of people and frame a plan of
हाँ
management. We also written many handwritten counseling papers, like how to
वो देखिए
apply
पढ़ते हैं
moisturizer, how to apply sunscreen, also frame the plan of management, and all that. Those days helped us work on all these things. we had a few patients in the initial years, but these days what I realized, the less was more, because it increased our responsibility towards our own clinic. We gave more time towards each patient, what the established practitioners during those days couldn't give. Because nearby me, there were many doctors who were seeing hundreds and hundreds of patients. But one thing I noticed that they are not giving time to the patient, they're not giving attention because they have to finish their entire OPD within a very short span of time. So what I had was time. So if I could give more time towards my patient, of course, that reflects in patient coming back to you again and again, because compliance is a big thing in our chronic dermatosis regarding may it be trichology, may it be your eczema, psoriasis. Patient need to come back to you, and if you have give time to them, nothing goes to waste. If you invest time, the patient will of course be with you for a longer time. So it also developed in less patient, it developed patience in me to wait for patients. Also more passion to see patient, because when you are involved in the patient, you counsel different things to the patient, you are becoming gradually passionate towards your work. So again, more attention, care, more ideas of counseling, because you understand how to counsel the patient, because what the patient want to listen, why the patient is not getting all right with others. So what I should deliver extra, or what extra I should do as a practitioner. That also gave a lot of ideas. So also more academic orientation, more zeal to spread awareness among the masses. So has given me a lot of advantages over a period of time. So gradually, what I understood that I was getting into a multitasking human being. Like I was seeing patient, I was developing as a counselor, I was developing as balancing everything, because also looking at my health. Like I also now I have a passion to sing, passion to play badminton. So all these things are also taking care everything in balance, because these days sometimes what I've seen my friends, they're entirely into private practice and nothing else. They don't do any extracurricular. They don't take care of their health, their mind. And many of my friends have also have family issues, and some have taken divorce also. So it is also about a balance in your life, not about only think patient. It's about dividing your time properly and dedicating it to your health, your psychological, your mental well-being, your familiar well-being, and everything. So what I gained over a period of time of my practice is about quality assurance, because slow and steady always is better than a faster growth. So quality assurance is something we got over time. We prepared hard copy materials, how to deal with human behavior with most appropriate approach. We won the trust of our patients. Practical ideas we developed and protocols which were not written in book, because in book will tell you only something like what to do, but how to do it will not deliver you how to do things that we gradually developed. Also, I upgraded my digital skills gradually, upgraded my surgical skills. Initially, in our college days, we never learned dermatosurgery. We gradually learned by attending some workshops, attending, looking at YouTube videos. Also, versatility of management. Like every patient is different. How to have a versatility of work. That also we gradually learned. Also something like one size does not fit all, and the same psoriatic protocol that we prepare is not the same cannot be given to all the patients, because the patient population, patient presentation will vary with time. So here we are, like our workshop will basically, the goals will be on goals that we already have discussed with you. It will be only a realistic kind of approach that will give you different options of management and how we can put that in our practice and go way forward. So this is the grow principle of this demo practice workshop. So hope you all are ready to go into this workshop and pull up your socks and run. So basically, we all are very good at our knowledge from the books that we know. We understand, we have a lot of knowledge about different information, different understanding, learning experiences. We have a lot of ideas. But what differentiates us from each other is the attitude. Like if you, though some people have a positive attitude towards their practice, while some have a very negative kind of attitude. Some patient, I have known of some of my doctors who don't talk with patient a lot, who totally avoid them. Some doctors, even if we are years after COVID, some doctors prefer to see patients 3 meters away from them. They make them stand 3 meters away and see them. So this is some of the attitude that is not encouraged in a private practice. You have to have a very passionate and empathetic approach. So attitude separates one practitioner from the other. And finally, how we put our attitude into practice. There are many practical things that you are going to see in our workshop. We have implemented. We know many things, but we don't do, because doing is something that takes a lot of effort. And believe me, it is the first step, which is the most difficult step. So we say that well begun is half done. If we begin something well, we are halfway across. So that beginning, I think, here we will tell you some beginnings of things like how we can improvise on certain things. That workshop here we are going to tell you. So the basics first, it's about how culture, work culture we do, care, communication, collaboration. Like care will, of course, will tell you how to take care of the patient. Communication, how to communicate, because these are the skills which are not taught in our curriculum. Communication is something like two-way communication. It's not like we tell the patient and we don't listen to the patient. So how we listen, how we communicate, that's some of the tricks that we are also going to discuss in this workshop. And also collaboration, because how to collaborate with our patient, how to communicate through digitally with them after they leave our clinic, how till they come back for follow-up, and how to collaborate with our staff, like how we can take the maximum uh, culture work from our staff, like how we can collectively treat the patient. Not only that, I think that I'm a doctor, since I have the entire responsibility. Now, how to divide the responsibility between the staff so that together we take care of our patient. That also we are going to tell you in this workshop. Now, who is going to do what thing? Like, which staff will do what? Like receptionist, what are you going to do? What is the protocol of their work? Well, how will be the reception work? How will the pharmacy work? How will be the lobby manager will work? How will the manager work in the clinic? Like different staff have different responsibilities in a clinic. Now, how to tell them what job to do and what work they will do? We'll give you written protocols about that also. So that also, when you have your staff in your clinic, you can use that protocols in your practice as well. So those soft copies will be sharing over your email, and that will be helpful in your practice as well. So we'll also demonstrate in our practice how we do it. So why own clinic? Like many people ask me that whether I should join some hospitals or I should have my own clinic. So I always tell them to have their own. Because there are some advantages of having own clinic, because you will enjoy your work. This is, I think, the most important thing, because this will give you time and freedom. Because time and freedom are something that money cannot buy. Uh, so enjoyment of you decide your own work and your life. The autonomy, the freedom that you get is only by having your own clinic. No one to rule you. Only the people above you is your patient. The patient will only criticize you. The patient will only give you ideas to progress. And you will have a direct communication with the patient. No via media. If you are joining a hospital, then you are remaining obliged to the hospital, but not to the patient directly. So that may take away uh, how to being attributed towards your work towards patient. You are not answerable to your patient directly when you are in an institution, but you are in your own clinic, you are answerable. Patient will ask you, sir, why it is not getting all right. So those that will also give you a sense of responsibility as well. So that is also an enjoyment. So earning own bread. So this will give you a satisfaction. Employer, you will employ people rather than being an employee. Like in my clinic, we have around 15 people who are there in our clinic. So that gives a happiness that we are allowed by God to employ people. So that gives a lot of satisfaction. Now, exploration of your ideas. Suppose you think that today I will uh, employ this idea in my practice. I will implement this idea. Had you been in a government setup or any institution, you will have to take permission from the seniors, from the hierarchy of people above you. But if you are in your own clinic, you will put your ideas into practice. Some ideas will fail, some ideas will give you dividends. So the experimentation will gradually make you a better person, and it will make you a better and mature practitioner. So this will finally lead to your ultimate goal. So what are the essentials? Now, if we put into the ABCDEF of private practice, it's something like these are the pillars of the practice. Like first is availability. I always tell whoever new uh, junior come to me and ask me like how to grow my practice, I always tell them these six things. The most important is availability. Now, if you are there in one clinic and always available at one place, then gradually people around you begin to notice you, and they will come to you because they know that you are available at one place. If you are going places like around 5, 7, 10 different places on different days, then very sorry, I'm afraid that your gradually your growth will not be good and optimal. So availability of yours in a particular place and time is something that is the most important thing in a private practice. Second is, if you are available, you have to behave properly with your clinic staff as well as your patient, because this will take you a long way. Then, of course, clinical acumen and how you work, the culture of your work is also very important. So along with the study that we have done in our post-graduation MBBS, you need to also develop how to work, that protocols. In our clinic, you will find many protocols of work regarding how to run a pharmacy, how to deal with the MRs, the managers of the company, because medicines and brands and they are keeping in pharmacy for poor people, rich people, having different flexibilities of different pricing and all is also an important aspect in private practice. And let me tell you that it is the pharmacy which helps you run your clinic. Remember, only by your fees and by the procedure income, you cannot run the clinic. It is very difficult. The pharmacy money will help you run your clinic, pay your staff, and with a healthy growth of your clinic is only possible if you have your pharmacy. So the culture of work, that will also, we will tell you how to develop that culture of work. Also, it is also about drug quality, because what you prescribe, that quality should be good. It should be tested. There are some companies which may be very new companies, but the drug quality can be tested if you have sufficient samples uh, of the company, new company, and try on your patient, on yourself. And if you are convinced good enough, then you can go ahead with prescribing those drugs. Similar work we can also demonstrate you how we do it in our practice. Also about discipline, about coming in time, how to stick to timings of the clinic. That also we will try to incorporate, and also tell you. Also dedication. So of course we need to be dedicated. Ethical practice. Of course, ethics vary from person to person, and there is no rule book where it is written what is ethical and what is unethical or non-ethical. So it is about up to you, like what extent you can practice your ethics in your practice, and also about flexibility, because this is one of the most important things. You cannot be very stringent, very strict always. You have to be flexible. And this also something that we need to understand. So if a newcomer like Dr. Harish is a newcomer, like I would like to tell him that I'll be sharing this. Of course, this recording will be available to you. So this is something you must have from day one. Like you should have two different fixed mobile numbers for the entire your life, you can say, because these are the numbers which patient will have throughout uh, till you live. So you should have two fixed mobile numbers. You do not change. You can change the you can change the BSNL to Vodafone or Reliance. You can do anything, Geo or anything, but the numbers should be fixed. That you cannot change those. Also, you should have two mobile phones to separate your personal life from professional life. One for clinic, and initially for a few years you need to handle it on your own. And when your number of staff increases, you can dedicate one reliable staff, one phone they can keep, preferably your receptionist, who can handle all the calls or your appointments, and also pass on their difficult queries to you, like how to handle the complaints of your patient. That also we will tell you in our practice workshop. Online clinic. Now these days, This is during COVID that we came to know that we can have a physical clinic and an online clinic also. But it is very important to understand that online clinic can never replace a physical clinic. Uh, so online clinic, however, we should be aware that any day AI may overpower our physical clinic. We never know. Maybe I'm speaking a bit early. So online clinic facility you should have in the as a backup, because there are many patient categories like very old patients who are your old patients. We have seen that you can avail online clinic in a very emergency basis. A personal assistant, of course, who can keep your maintain mobile phone data and schedule. Also, you should have a vehicle, the necessity these days, so that you can move on from one place to another. A mini laptop you should have, so that you can have your workplace maintenance can be done. Also, of course, the digital marketing, you should have your Facebook page, Insta, YouTube channel, everything. So these are something you must have from day one. So soft skills, it is always the little things that count in a practice. It's not the big thing. So focus on things that are small enough to change but big enough to matter is by Cat 4. So these are the 10 soft skills. Like I need not say every one of us know these things. So just a revise of all these things. So when should I plan my clinic? Some of the starters also ask this question, when should I start? I will tell them the earlier you start working on something, the earlier you will see results. Some people start after 10 years, some people after 15 years. Remember, the zeal for starting the clinic is the most when you are starting. Like the day one of your, after you start, I started after I finished my post graduation. I didn't do any fellowship or any other training or any, I didn't join any institution as assistant professor or anything. Straightforward, I joined into private sector. So I can tell you, if you start early, then you can have a very good result. Then again, the location. Many people talk and ask me, where should my location? So the honest advice will be any fixed place that differently won't change with time. So it can be anything like your own location or something, a place that you can initially take as a leave for 5 years, 10 years, and gradually you plan to buy that location later, so that you have a prospective clinic on that place you build up. So you can plan accordingly, and it is always better to have an accessible location so that patient can reach you, having a better parking facility. But if you talk about long term, it doesn't matter much. I've seen many successful practitioners who have locations in a very remote areas and they are doing very well. So, but of course, in these days when we are in a digital era, Google Map registration of your clinic location always helps. So when you start your clinic, always register your clinic under Google Map. Uh, so initially, you can go for peripheral location to have your clinic, but later, after around 6 months, 1 year, when your patient build up, always taper off to the primary. Also, always keep an option of virtual availability for selective patient population groups. This is understood as like you can say as an online platform or a WhatsApp consultation, you may say. So you can have it on emergency basis if it is required. So outstation clinics, if you have some key point, it will give you a bulk number of patients, because when you are struggling for income in the initial days, this will give you bulk income. It will give you a binge revenue, of course, so that you may be relaxed to practice in your prime location, though you have less number of patients. Your clinical touch is preserved, of course, and you see a lot many variety. Then you say, then your clinical touch is remaining, is preserved, and you can get surgical cases which you may pool to the main clinic. That is also an advantage. And also it helps in sustenance. This is most important. Now, disadvantages, you have many patients, so you cannot see the patient in quality because you are delivering quantity there. The problem again is sometimes what happens is shopkeeper there, you will not be available for around 28 days. You go only 2 days a month. For the rest 28 days, shopkeeper will dispense the medication as per your his benefit. So he may compromise the quality. He may replace the medication. And sometimes even I think they do the procedures also. So that is not going to help you because your name is being utilized for wrong purpose. Also, procedures cannot be done in the periphery. You have to bring them to your place, and there are, of course, travel risks. I myself, I faced a big car accident, when I was coming up from a peripheral location. And that was one of the days when I started to taper off all my peripheral practice and focus on a single location. So there are travel risks that also has to be seen. So some of the tips to peripheral practice is like your peripheral practice should not have the shopkeeper's prescription, like their shopkeeper's name, shopkeeper's shop's name, their numbers. Always have a term and condition that you will on the prescription will display your prime city clinic address and your mobile number. So this condition will help you because those prescription patients later when you taper off to your own prime location, they will come if your treatment was good, they will come back to your prime location after 1 year, 2 years, 3 years. They will come searching after you. So this will help you out. And very important, do not visit more than twice a month to a single obstetrician. This is unnecessary. And always try to dispense the same brands everywhere. And this is something that I need to tell you that you negotiate with the companies because you cannot go on writing any ABCD company or anything. You negotiate with your good companies so that you'll get more amount of bonus. Now, when you run a pharmacy, these are certain things, and you need to understand that you buy more and they will give you more amount of bonus. So everything this should be maintained in a proper way. That transparency in WhatsApp group. I will tell you if you are coming to the workshop, I will tell you how we maintain the transparency, how we negotiate with the company and everything. That also we'll discuss. Now, when to taper or stop peripheral outstation? Initially, for 1 year, 2 year, we are going to outstation, but when to taper? This is also very important. So when you decide, that is up to you. When your gradual number build up to around 2 digits, say 10 more than 10 patient in your prime location, that is the time you should stop peripheral obsession. That is how I looked at it. Now, how do I plan my clinic? A basic framework, it should be own land, if preferable. Don't prefer rented or lease as much as possible because there is no surety. It is better you buy your own land. You may take a loan if possible. And if your parents are helping out, that is the best thing that can happen. Try to build your own building, better than rented one. Basic investment capital, a part you may contribute by your parent, by your own savings, or and part may be taken as a loan. So basic procedures you should do initially is of course PEELs, RF machine, biopsy instrument, ultracentrifuge, OT light. And believe me, RF machine will do many things. Right? It's a multi-purpose machine. Even the Derma India 20,000 machine, even still I have that machine and it is working wonderful. So that is a poor man leisure, you may say. So here basically in a tier 2 city, we don't have a high-end machine, but we make the best use of the cheaper machines to the best use. So try to have your own pharmacy from day one because that is a big support that will help you out in your practice. And also online clinic, though less in number, but it will help you a little bit of publicity. It will not give you a good revenue, but it will make you known in distant places, in even metros. Like in metros also people will know you because you are available online. So your advertising is also it's a part of advertising where you may also earn also because you may also have an online pharmacy because in our clinic we have an online pharmacy as well. To those patients who are online, seeing online, we dispense them through the post, even the normal India post, which is very cheap. And we'll discuss late in detail if you come to the clinic for workshop. You may note it down all these things what I'm telling you. And while we are having a discussion, we may put this in the discussion. So clinic staff, when I replace my we, even illness become wellness. I think this is something that I have always believed in the power of my team. Now, if we see this diagram, this is a patient journey road, like how we in our clinic see our patient. This is one diagram that we have done. Like when the patient enters, you can see here, this is the reception. This is the first flag. Patient is entering the reception. This is the road. You can see the road map to the patient. So here the appointment and all this is made prior. When the patient is at home, the reception has booked the appointment. We keep the patient only with appointment, and sometimes the spot registrations are also done. But we'll tell you how the seat structure we maintain. So after the reception area, patient waits in the lobby waiting area, and also they're taken to the photography area to check on all the uh, baseline disease condition that is recorded. Then the patient waits, and if there is the photography consent, that is also taken. Then lobby waiting area, patient wait, and how we take care of the waiting to make the waiting worthwhile, so that they're not bored or they're not restless, and they don't complain. There are some initiatives that we have taken that also we are going to discuss with you. Then the patient wait, then doctor consultation, patient discuss with us all the plan, like how we do and all. Also counseling that we take care. Even now we are doing counseling prior to the patient meeting the doctor. That also will tell you how we do a prior consultation counseling. That is also sometimes important. Now, pharmacy, after patient take the consultation, they go to the pharmacy, or if procedure is required, they go to the procedure room, and then they're finally this is they finish off. Now, after they go from the clinic, then also the reception and the counselor, they are in touch with the patient along with the pharmacy staff. They have separate numbers of pharmacy, reception, and counselor, so that the patient can anytime be in touch through WhatsApp, not by calls. We avoid calls in our clinic because it is the WhatsApp which makes things very easy. Don't tell your patient to call. Always ask them that whatever doubt you have, you write down, because the writing is something that patient will do it. It will take quite a pain for the patient to write down, because when the patient speak, he will go on speaking, asking you hundreds of questions. But when the patient will write, they will be brief. They will try to write it in shorter version, as short as it can, and you reply as per your convenience. You tell the patient that reception may convey to the patient that doctor will reply in 4 hours, in 5 hours. So that waiting time also patient is mentally ready that okay, I will wait for this much time, and you reply as per your convenience. And reception will uh, tell you when to reply, because we have a common complaint group where their receptionist is there and myself, we are there. The patient drops the complaint to the receptionist phone. Receptionist, they transfer the complaint to the complaint WhatsApp group. I reply in the WhatsApp group of complaint WhatsApp group, and that same reply is transferred to the patient. So the WhatsApp group, the interface between me and the patient. I do not communicate with the patient directly. Rather, I am the interface. I am the WhatsApp group is the interface, and I am away from the patient as well as nearby when it is required. So this is something we maintain, and it keeps peace, and it don't keep put you a lot of into a lot of hassle. So this is what also we can do, like complaint group consisting the receptionist, you and uh, both of you, and the patient will drop the message to the receptionist. So these are something that can be discussed. Like also staff composition, sequence of hiring. Initially, I had a single assistant. I could not afford a lot of staff initially. So we had only an assistant, and gradually we hired a housekeeper. We had a receptionist. Gradually all this happened. Initially, we used to do everything together on our own. I have even done some housekeeping myself. I remember those days fondly. I remember, because but I will tell you, if you do everything together, one day you can guide everyone properly, because you know how to do housekeeping, you know how to use the broomstick, how to use it properly. You see the corners, you check the corners, and you can know that whether a room is clean or not. So it will give you an idea if you are in their shoes in any point of time in your career. So also it's about managers. Like initially, I myself was the manager of my clinic, but gradually when the work load increased, then I hired a manager. So training of the manager is very, very important. So when you come, we'll display the manager room to you, and we'll also have give you ideas about how to manage your clinic effectively and manage your lives, manage your documents, manage the expiries of different licenses, like drug license, like your any document you can say, like your driving license, like your Aadhaar card. We don't know when it expires. So those expiry dates can also be remembered in a very easy way. So that also will share with you how to do that. So it's about managers basically. So you have to be a very good manager for your people, along with your assistant manager who are there in helping you, should also be a good leader. Now, also about hiring, grooming, and retaining employees. This is something also very, very important. We all help, we all need help along the way. So, how to hire, everything we'll discuss in our workshop when you come. So, should I do camp? Many people tell me that when I start my practice, I should do camp or not. If you ask me, I should tell a big no. Initially, these were the days when I was into many mega camps. But I'll tell you, these are pure wastage of time because here you don't get genuine patients. Basically, the motive of these camps is basically to have a publicity of their institution and nothing else. You are just being used as a puppet by giving some free 1,000, 2,000, or 5,000 rupees every day. They will try to take your time. But I will tell you, if you sit in your clinic and uh, just see one patient in that day, I think that is more valuable. Doctor delivers his best only inside his clinic chamber. Anywhere else, his or work, her work efficiency is compromised. So you sit in a camp or sit in an outstation, you will not give the same efficiency that you sit in the comfort of your clinic chamber. Most important step in patient recovery is intent to go to a doctor. Because in a camp, what happens is uh, you are going to the patient. Patient, those who come are not genuinely dermatological patients. They will just come to ask for a tonic or something like that. That will more think unproductive. Always remember, patient in a clinic pays you a price, and what is not, which comes free, is not valued. So paying money is not about money; it is about value. So money and value are different. So patient should pay for a prescription. Patient should pay for a medicine. You may provide sample, but a part of the sample should be provided, and you should not provide the whole prescription as a sample, though you have the samples at your disposal. So freebies always lack accountability. So you should not be into a lot of freebies when you are into private. So disadvantages of health care: lack of genuine intent of treating people, because we don't go there to treat genuine patients. Vested interests are more political and social. It is not medical. Like, we don't go to treat patients basically. So few genuine patients are there. Attendees seek freebies. No follow-up is ensured. So once you see eczema patient, he's gone. He will not come back to you. Medication quality is compromised because the quantity is very less in the camp. Organizers lack commitment and accountability to treat. They are only is to do publicity. You lose a valuable day. Remember, don't lose a day in your practice. That is very difficult. You may go for a holiday. That is not a problem. But when you see patient, you should see in your workplace only. So this is something that you can do. You can find some time out of your OPDs, and in the afternoon when you get a relative time like 3 p.m. to 5 p.m., you can go for awareness camp, making the young mass aware of the common problem like acne, hirsutism, hair loss. You can do it because this is the real time that we can spread awareness. But don't treat, don't write a medicine when you are going to such camps. Make them come to you. Let your clinic be the camp place. So one of the first duties of a physician is to educate the mass, not to take medicine. Like, we should try to instill the lifestyle basically. So that is most important. Even in PCOS case, we have a health booklet that we have made for instilling education about how to lose weight, how to take food, how to make food the medicine, not the medicine your food. So awareness camp, prevention is better, makes you popular. If you have a target audience to cater to, counseling skills improve because it will also help your counseling skill. Because when you go on to an awareness camp, many queries of the public will come to you, and you will have the courage to counsel and answer them. So you get a lot of ideas. Your horizon of counseling gradually increases. Also, the sanity of a clinic, because a clinic is such a place where the patient should come. So when your brand value increases with the awareness camp, people will try to and love to come to your clinic and take your treatment, and your expertise value is also bigger. So it's not camps. How can I genuinely help people? If you're not doing camp, can you help me genuinely help poor people? If I want my patient to value my work, I need to value my work first. This is, I think, I have learned the hard way, because the patient, you should value your own work. So if a patient is giving you 300 rupees, you must know that you should give him treatment worth around 3,000. The attention, the passion, the work, the counselor, the staff that you are taking all the effort that should be costing more than that 300, 500 that the patient paying you. So your work should be that much valued. So this is what you can give to your patient. So plan camps at your own workplace. You can do some camps. Some of the days you can keep low fees and less fees you can see. So keep the camp attitude in your own clinic, but under covers. Means you should not make everything free. Part of the medications can be delivered from sample, but part the patient should buy from your pharmacy. So the freebie attitude is curtailed. Like don't encourage patient to for freebies. Part of the fee also you can waive if required. So in our clinic, we have a poor man sample store. I will also demonstrate you how to manage that sample store, because this is like a medicine store, and how to keep a balance of the company people visiting you, how to ensure they are giving you sufficient sample so that you can manage in your clinic and make the proper utilization of the sample for different purposes. May it be post-procedural, complementary packs preparation, or may it be delivering a part of the medicine to the poor man. So this is something we are doing in our training, and I will demonstrate you how we do it. So no mediator, there is no political or social groups involved. You are conducting the camp, you are planning the camp, and there is no compromises made in the treatment. So this sort of camp in your own workplace is valuable. Now coming to pharmacy, you have to have your own pharmacy. So the best pharmacy is your own pharmacy. Remember, for the patient, best plan, best medicines, best brands, best counseling of how to use the medicine is only done in your clinic, because you are the master of your own prescription and no one else can deliver the justice. Because own pharmacy you will have a quality control, you will have a sense of responsibility, accountability, counseling of the nuances of intake and application of topicals or intake of the medicine can be done. Only you have your own staff can do it the best way. Also, sometimes we may skip writing the prescriptions in. Sometimes we want to write BD, might be we have written TID, because these digital prescriptions are there. Sometimes there may be fault. Now, when the same prescription goes to the pharmacy checks that you have written something unusual, what you used to write every time. Then they may come back to you and ask you, sir, you have written this TID, is it right or wrong? So you can make the correction. Now, just think, a wrong prescription goes to outside. Means you have written methotrexate. Sometimes it's a bad day, you have written methotrexate daily for your patient, right, rather than weekly. Then it will cause havoc. It will cause damage to your patient. So if had it been your pharmacy, the pharmacist will come back to you and get it checked and revise it once again. So a cross check of your prescription can also be done. Also, pharmacy at the bottom line is revenue generation. Now, this is very, 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 very important. Pharmacy will deliver you something. Also, money is very important when you are going to run your clinic, because this will make you stable as a person, your clinic stable as a running institution. So you need money for everything, from the pin to the building. Everything runs with money only. So you have to have a good revenue generation from your pharmacy. Now, online clinic, remember, change is the only constant. We never know when things will change, like everything can change online. So the future of work will be basically like with virtual skills. So virtual care is the future, what it seems, because we have to adapt to change. Suddenly COVID came and we have to adopt to online practice. You never know when there will be many more pandemics, or when people will try to prefer to AI-based consultation, which gradually we are seeing. So change is the only thing that we have to adopt to change. So we have to keep this online clinic option open. Though we are not making a lot of online consultation, but you should tell your patient, each and every patient, that we are also available online. But you have to be choosy in selecting the types of online patient. You cannot make it easy for patient like Amazon or Flipkart. You have to be choosy, like prioritize patients' genuine limitations. For example, if I'm in Orissa, some patients of mine are there in Jharkhand, some are there in West Bengal, and they are on complete remission. I am treating them for psoriasis. They are on complete remission. Just they need is a tapering off of methotrexate, or a tapering of a steroid, or anything like that. And that's just minor change. They cannot come a long way to change that only some dose. In such cases, online consultation comes handy. So this is something like, and some old age person, they cannot come to your clinic, but they genuinely need your help. Those can be helped online. So online follow-ups are better than first visit consultation online. I don't prefer first visit online consultation. I always try to tell my patient, first visit you should consult me physically. And when I know your disease, when I have made you understand the disease properly, you go back home, you go into a remission, then we can follow up your disease better. And because I have already an idea about, fair idea about your disease. And it's also help in compliance because patient follow up does the follow up regularly, and also keep an option of online pharmacy so that you can deliver the medicine at the doorstep. Now, convincing a patient, many of my newcomers ask me about how to convince a patient for procedure. I would tell that convince is really a wrong word. Rather, convey is the right word, you can say, because it is the patient who decides finally what he or she is going to do, whether he is going to opt for the procedure or not. So it is always about conveying the pros and cons of a procedure to the patient and leave the ball in their court. Let them decide whether they are going to do the procedure as per their financial capacity, as per their need, whether they value the procedure more than money. It is up to them. So it is not about convincing it only for a financial gain. It is also about the practicalities of a patient, whether they can do it or not. So source of conveyance that works is info from a previously treated patient. This is the easiest conversion because if a patient who has gone up treated their acne with a salicylic acid peel in your clinic, they go and tell to their friend that do a peel, you will get the best result. The patient will come and directly convert it easily because you need not tell them a lot about peel. They know that, oh, my friend had done that and got good result. I will do it too. So also about now, if they do not know that, you can show them before after in your laptop or in your, we have different albums in our clinic. We'll also show you how we maintain the physical album, like before after pictures are kept in album also. So that can be also shown about the procedure apprehension. You can also show videos like how easy the procedures are and are less painful about aftercare. Also, you can run lobby videos in your lobby area and also about YouTube videos you can make so that you can spread awareness about different procedures. Facebook and Insta page, these days everyone is coming up with so many pages and all. Like it depends on you how you promote your work in your place because every workplace is different. Like Mumbai cannot be compared to Bhubaneswar or Bhubaneswar cannot be compared to Kochi. Every place has their own uh, population, own set of awareness of different procedures. Also, it is important to have pictures. Now, in your clinic, you should have a picture. You should have provision to have a photography room. In our clinic, we have a provision also. We'll show you how we take before after of our patient. You can see some of the pictures. Like these are one of the phenol peel that we had done. This was an experiment on the split body because on right side only we applied the phenol. You can see how it changed casually. The complete repigmentation over the right-sided lesions, whereas the left-sided lesions did not repigment a lot. So this is a photographic comparison that helped us uh, deduce that the phenol wounding in vitiligo is one of the very good modality of treatment. So pictures speak 1,000 words. You should always stick on taking good pictures. So these are some of the pictures of our patient, how we took. Now, these are really helpful when we convert our patient for procedure. Like phenol wounding patient may be scared or apprehensive about phenol wounding. You can just show them that how the results are within 1 month. You can check the date, like 11 July 2018, 12 August 2018, patient repigmentation has already started. So it is hardly 1 month. So these sort of changes, patient is encouraged to take the procedure, to do the procedure. So you should always have before after in your laptop, in your albums if you are making. So these are certain things. So within 3 months, within 2 months, patient got the results of phenol wounding. So this is something that can be also done. Like these are some of the other patients like alopecia areata, taking intralesional therapy. Now, how patient can be encouraged to take intralesional. Now, these are some of the pictures, the position, how you take the photograph has to be same. We will also tell you how we do advertising by sending these pictures to patients' mobile so that they go on telling everywhere that I got results. So that also will tell you when you come to. There are so many things to tell you, which will help you out in your practice. So apprehension, like patients are sometimes apprehensive about doing a procedure. Um, so this is like an melasma patient, like how we saw the procedure. Like you can see how we do the microabrasion. Like, or you can demonstrate this to your patient. Like the procedure of microdermabrasion can be shown. So, so this is how the techniques that you can see the peel, how we apply the peel. This can be shown to the patient, like how we do it. Like to counsel a patient for a pigmentation to do a peel, I can show these. So this is simple step. We know it. There's no science here. It's just the art of demonstrating the patient, like how we apply the sealer, like we apply tretinoin cream as a sealer, like how we apply the seal after we apply the peel. So you can see the technique. So there is no science here, just applying the peel and sealing it off with the fingers. So the patient, you also treat them with different creams, so different monthly peel sessions along with the treatment. See, the melasma has improved. So the such pictures can be shown to the patient. These are something called realistic expectation. Patient should not expect like a magic, but what you are actually doing in your practice and you have got result. Patient feel encouraged to do the procedures. If you show them such kind of pictures, what can happen in real time. So holistic care is more of under the skin derangement. It is not about the visible skin changes only. Now, this is a very important diagram that we always tell in our practice, in our workshop. We'll tell you around, I will tell around 30, 40, 50 times about treating the skin from the top, from the middle, and from the bottom. Those who have attended Dr. Kavi and Dr. Dharmendra will agree that how we keep on telling them about treating from the topical, treating from the center in the dermis, and treating from the systemic aspect, from the blood. And every disease has these three different strata of treatment. So topically, you are attacking the disease. Dermally, you are going either giving intralesional or any sort of treatment. And from the blood, we are trying to also to attack the different diseases like eczema, psoriasis, acrophodone, anything that under the skin derangements are also there. So invisible disease is something that should be treated, not only the visible disease. Now, patient always give an example of a tree because patient usually understand common things. Like tree is a common example that you can always give to your patient. So most of the time we use this example to tell our patient that even though you are on remission, you have improved after 2 months of treatment, don't be very happy. Always keep in mind that your systemic abnormalities like eczema, psoriasis, those are not only localized disease. Those are problem of T cells. Those are problem of blood. So even though those have improved from your skin, they are still inside your blood. And to the time that we don't tell you to stop the medicine, don't stop the medicine. So those are things of counseling. Patient groups who easily undertake procedure are referral cases. Those are referred by other patients or doctors. Recalcitrant cases because who think that we are the last hope. Counseling skills, making the patient aware and affordable patient. Now, how to set charges of procedures? This is something like very common as a new practitioner. Do some research of prices in your place. Start a bit lower, but rise the price steadily as your demand grows. Like if a peel is someone is taking around 2,500, you can start off with around 2,000. But you can also raise it gradually when the demand increases. Also, it is important to cater to different groups of the population, like poor patient and rich patient. You can keep a peel range of around, say, 1,500 to something around 3,000. So those people who are coming to you are very poor. What you can tell them that the procedure charges is 2,500, but for you I will make you 1,500. Don't tell the patient it is 1,500 straight away, because what the message you are giving outside is that patient will sit by a rich patient the next day and tell that this doctor has done me the same procedure with 1,500. Then same procedure in the rich patient is a 2,500 or 3,000. So what will happen is they will come to you and put you in a dilemma. always tell the poor patient that this price is more, but I am doing it in a less cost for especially you, or giving them a card. Like what we do in our card in my clinic, I have this card, I will give you the um, piece of this card also you can utilize. So this is something like a procedure discount card. It is given to procedure poor patient, to students who are all or who ask for the discount, to give them a discount of 500 or in each session. So there are 3 different lines written here: first session, second session, third session. So they can give discount in different sessions, 500 each. So this also is a good idea. So those who have this card only can do this in less amount. So this is something also innovative thing that we have started doing here. So pricing clinic services, it has to be competitive. We should not make it very low, because these days people think more the better. The more costly they are doing, the better feel they get. So it is more of a like psychology. So track record of past success stories should be there in the clinic. Brand value, value for money. All these things should be taken into account. Like your brand value is also very important. You are a 5-year-old doctor. You have done many procedures. So your popularity also should be tagged. Your price of your procedure also depends on all these things. Now, finally, it is very important to put yourself in customer shoes, because patient, this is how the patient thinks. This center charges 4,000, Dr. X charges 3,000, Dr. Y charges 2.5. So show them these pictures, like how you get the results gradually. So this helps in convincing the patient a lot. Like some of the pictures are like this, now before and after. Now some of the patient, like for example, PRT, someone is confused about money, we show them these pictures. We deliver results. We try to give the patient best result. So you can show them realistically how much change can be expected. Sometimes you may show these pictures also, because patient will, when they see good pictures, they will have unrealistic expectations. So sometimes show them this kind of effluvium picture. The patient had an effluvium of losing a large area. So their coverage is around say 25, 30, 40%, not more than that. So give them a range that your result will be from 40 to 90%, not straight away jump to 90%, to just to convert the patient. So these are also kind of results that we have given our patient, like um, remarkable changes, and also sometimes this subtle changes. Sometimes patient may tell you, "I'm not improving." Show them these pictures. Like it is improving, though the density is not quite as you want it, but it is improved. So this is something subtle changes. Now alopecia areata. So alopecia areata whole total is also patient can get that the hair. Give them hope when such patients turn up to you that this is possible. We will try our best to give you these results. We cannot assure, but we will definitely try. So this is very important. So health for all is very important. So you should set a price range. Even the poor and the rich both can afford your clinic services. So this is very, very important. So who is a poor? Appearance, conversation, expenses. This my teachers have taught me. But how the patient looks, you have to judge from the door of your chamber. The conversation, the expenses more than his income. Like ask for his income sometimes, how much he can afford. But don't show your rudeness to the world. Never show that you are very kind, you are very good. Those things you should not show it to everybody, because when you open up the kernel of the coconut, everyone will try to consume the kernel. So always be like coconut, tough from outside and soft from inside. So you should be very judicious in showing your soft corner to the people around you. It should not be very soft outside as well as inside. So clinic on Sunday holiday, many people ask me this. So, so what advantage? So I will tell you, if you are on Sunday holiday, is entirely your choice. But if you tell me, if you ask me, my preference is holiday is a half day for me. And the second half, I don't work on Sundays or a holiday. So those days I try to maintain half day. So what advantages the new practitioner offer his patient better than institutional professor or popular busy practitioner? It is ATP. ATP stands for attention, time, and delivery. So when you are a practitioner who is not very busy, when you are a starter, you can give attention, you can give time, and you can give privacy to the patient. So clinic with all these things, patient will attract, come and running after you like a magnet attracts the iron. So this is your clinic should be like, should have this six things so that patient will come to you. So why should you work on Sundays? Working class prefer consultation on these days. Half-day practice is logical. It won't break the rhythm. Like it is important. Sometimes you break the rhythm of your practice. If on Monday becomes difficult when you take a whole day off on Sunday, so it won't break the rhythm. Optional holidays are more worse. Like you can take, like in my practice, what I do is I take around 4 to 5 days holidays every month, but I keep it flexible. Any 5 days that I want, I take holiday. Those are my Sundays for me. The consultation fees depends on city of practice, years of practice, affordability, local dermatologist, how much he's charging, clinical and aesthetic practice ratio, quality and quantity based practice, everything. These are something that we all know. Just that I'm revising it. So if you tell me how can I raise my fees? So depending on inflation, 6% is the rise in inflation rate every year. You must know this. So if you say 6% inflation, say my fees is 500. So it is around 30 rupees every year, the inflation. So my fees should be 530 the next year. And similarly, 560 or something like that in the next year. So if you say, then it is around uh, every 2 to 3 years, I should raise my fees by 100 rupees. So you can also put a ceiling on your fees. And the raise fees only patient load is disturbing to you. Now, if that is very individualistic decision, that is up to you. Like if your patient load is very high, you want to restrict your numbers, you can also raise your fee structure. So this is all. I hope you were not bored down by this long presentation, and hopefully these are some helping points to you in your practice. And thank you very much for the patient hearing, everyone. Thank you very much.
Thank you, sir. Thank you, sir.
Thank you, sir.
If you have any other queries, you can go
Thank you,
ahead
sir.
and ask.
Thank you, sir.
Yeah. Anyone has any queries, you can ask me. Dr. Vikas. So I would like to know that how long are you all into practice? Like how many years into practice you all are? Like Dr. Kavi, I think
1.5 years.
two and a
1.5
half
years,
years.
sir. 1.5, sir.
1.5 years. Okay. Dr. Vikas.
Sir, I'm since 11 years, sir. 2012 I started, sir.
Okay. So you are nearly my age. So both are
Yes,
same
sir.
age around. So it's around 10, 11 years.
Yes, sir.
Yeah, very nice. Nice. Yeah, Dr. Aishwarya.
Sir, I passed out in 2022. So 2 years of practice, but not. I haven't yet started my private practice yet. I'm still in the institute.
So you are keen into starting the practice, right?
Yes, sir.
Okay. So I think this will be really helpful to you in this. All these tips and tricks will help you all.
Yes, sir. Of course.
Yeah. And what about Dr. Harish? Are you there, Dr. Harish? Can you please come onto the screen, Dr. Harish and Dr. Dharmendra? Yeah, Dr. Dharmendra.
Good afternoon, sir.
I think you're outdoors.
No, sir. I'm a hostel. I'm from hostel.
Okay. Dr. Harish, are you there? तो डॉक्टर धर्मेंद्र आपको कुछ कहना है?
Nice, sir. कुछ नहीं. Sir, you
I
know
think he's
all
very
things about
active.
me. We are talking regularly. So hard to
Dr.
travel.
Dharmendra is a very active person on WhatsApp. He keeps on asking doubts, very active. So, Dr. Harish, are you there? Okay, so perhaps Dr. Hari is off. Okay, anyway, so we have now come to the end of this presentation. Now, I think I will share you one more presentation. This basically will be the questions or the case scenarios that we will give you. Okay, so I'll be sharing this in your WhatsApp group. What we need to do is just take on your prescription pads that you are, every one of you are writing on physical prescription pad or digital.
Physical, sir.
Physical, sir.
So
Physical.
everyone, okay, fine.
Physical, sir.
Okay, so what you do, take on your prescription pads, and we have around 12 to 14 case scenarios. So just take 12 to 13 papers of yours from your prescription, and you write down those prescription as like you have seen the patient. Okay, so we have given the body weight, we have also given the investigation reports, everything. So what is your plan for the patient? You just write down the prescription and bring those prescription when you come to the workshop.
So do
So
we need to write the trade names or the pharmaceutical names, sir, of the drugs?
you can write what you can write is just you can write the composition, just the chemical name, and the dosage that you will prescribe to the patient. And the way you prescribe, like the way you do in your clinic, exactly you have to write that. We just want to see that how you approach, how you think, so that we can go to the next level. Okay. So this is the way how we will go ahead in this. And every day morning we'll have the review depending on the session. Suppose we have a trichology session, we will have a review of all your prescriptions regarding those trichological cases. And the next day, if you see melasma cases, acne cases, then we will discuss your prescriptions also, like how we can improvise on your prescriptions better. So those things, I think this is a new addition to this workshop. Last time we didn't do this, but there were suggestions to buy that our, what's his name? From Mumbai, he was from Mumbai.
Hardik.
Yeah, Hardik suggested this, that we should have one such kind of thing. So I thought this time around we'll add this to this workshop. Gradually, we are trying to make it more innovative. So I'm just sharing the screen and just displaying all the questions, just refreshing all the questions for you all. So is it visible to you?
Sir, we'll be sharing this PPT separately also, no?
Yeah, I will share this PPT separately also. So is it visible to you?
Okay. Not yet, sir.
Visible? Visible to you? Hello, am I visible?
Yes, sir. Visible, sir.
Yeah, yeah. So
Sir,
this is the
sir,
basic format.
you are visible,
So
the screen is not visible.
okay,
Okay.
okay. So this is what the PPT is about. If you have any queries now also, you can tell me. I will edit, do some edits and send the updated PowerPoint. So this is something like this. Just imagine that these clinical cases are turning up to your OPD. Take up your own prescription pad and fill in the patient detail like name, age, weight as given in the case scenario. Write their name, like whatever is written. Pen down your prescriptions as you would do in real time in your practice. Collect all the prescription, bring it to you with you to the workshop. If you have an additional cover file to carry the prescription, bring the cover file, one cover file along with the prescription. One cover file would suffice to carry all your prescriptions. Don't bring multiple cover files because they are more bulky. Try to make one cover file and bring all the prescriptions. So this is some cases like this case scenario. 40-year-old farmer named Ramu, weighing 70 kg with such lesions over arms and dorsal hands since 1 year. he has no comorbidities and his blood parameters are very normal. So this is the basic thing that we will give you. Do you have any queries, like whether should I provide more information or this is okay? I want an answer. Okay, so I'm moving on to the next.
Sir, any
Yeah.
other site with any? Okay.
Sorry. Okay, let me finish off. Then we discuss. You note down all your queries. So after I finish this presentation, we will have a discussion. So next is the psoriasis patient. This is
Okay.
a psoriasis patient in practice. So having a 25 DSA, body surface area involvement, body weight 62 kgs, no other comorbidity, blood parameters within normal range. Now this is a scalp psoriasis patient. Similarly, we are giving age, we are giving duration of disease, we are giving the body weight, and some investigations and all. So this is a recalcitrant seborrheic dermatitis case. This was a case like you see how the pigmentation, like melasmatic patches are there, like aging changes are there, like some like looking like LPP at a few places. Now, if such patient come, how are you going to approach such cases? This is a case of recalcitrant melasma. Patient is taking multiple treatments but not responding. What is your approach in such case? This is a case of vitiligo case. Everything we have tried to give you. If you are feeling something else, more information you need, then I can edit and send again. So that also you can tell me.
Sir, in melasma or such cases, any the previous drug history which he or she has taken before coming to you,
Yes, patient
or
has taken
medications
tranexamic acid.
have been used till now in
Just
the.
think, yeah, just think that patient has taken everything. The calcitrant melasma, when I'm telling that, patient has carried multiple prescriptions to you, around 10 prescriptions. Patient has taken everything. Patient taken tranexamic acid, patient has taken this, that, anything you can imagine, like ligament, like patient has taken sunscreen, everything patient has done, but he is not responding. So how should be your approach to those people? Now such type of patient will come to you. So this is another patient. Here the case of PCOD, as you can see, mandibular lesions are also there, and there is multiple acne. The patient has a TSDF with acne, with anemia. He has applied multiple cream, Tobet-GM on steroid, high potent steroid, and one childhood anemia. Sometimes we may be encountering such cases. So parents have anemia. So how we are approached to it? What a picture is versicolor case. That's very common cases that we see. Now this is something like senior. This was by request of Harish, we incorporated this case, onychomycosis. Such cases come, like how you manage. Something that, and this is vaginal wart, non-pregnant lady come to you, how we manage. Urticaria, very common case. Okay, androgenetic alopecia patient. So, how we are going to alopecia areata, child. This is something that basic cases that we have incorporated here. I think all of us have such cases in our OPD, right? I think if you take all these cases, around 70-80% are these cases, if I'm not wrong.
Yes.
Can we add some more variety? Can you tell me? Can we add some more varieties or this much is sufficient?
Sir, STDs.
STDs we are not going to discuss because otherwise we cannot cover. Because you'll see these 3 days will be so
Okay.
rigorous. STDs in book. I will tell you some basics. I will tell you like herpes and all. But if you include all, you cannot cover everything. Procedures, we'll be discussing about procedure, about clinic, about common cases, about very difficult. It will be, your time will just fly. You'll see. So, any queries you have, you can ask me
Okay.
during STD. But special cases, because
Okay.
to
Okay.
be very honest, we are not seeing many number of cases of STDs in my
STDs.
case, in my clinic. So when you start, like if you speak in
And
South,
here we
Andhra,
see
many cases.
STDs regular.
This zone, we don't have a lot of STD cases. So I think
So
Dr.
for
Kavi
syphilis,
can give you a lecture. Dr.
No,
Kavi
sir,
and
even I
Dr.
tried the same
if you can just see syphilis
Dr. Vikas,
in
even
this,
Dr. Vikas
because
can
here
give you a
we
lot of
have
idea about STD.
for me.
Yes, yes, sir. We get quite history cases here.
Because we have.
Eh,
So we can have a discussion on STD if you get time. Okay.
Sure.
Oh,
Sir, female
Okay.
pattern hairless problems.
Yeah. We'll have a discussion on effluvium, telogen effluvium, like diffuse unpatterned alopecia, DIPA. We'll have a discussion on alopecia areata, trichotillomania, scalp, anything you can think, like seborrheic capitis, recalcitrant seborrheic
prurigo,
dermatitis.
sir. Prurigo.
All these things we'll have a discussion.
Eczema testing.
Sorry?
So recurrent folliculitis of the scalp, sir.